today we're talking about ED, typically erectile dysfunction, but I hate that word. I prefer to use erectile dissatisfaction. It means it's working and just working and not working as well as one might like it. I mean, wouldn't it be wonderful if a great sustainable erection and amazing sexual function was as simple as a little blue pill? Well, for some it is. But not for everybody, and by the time many men get to us, they've already tried the blue one, the yellow one, the white one, and probably a cabinet full of internet cures, none of which are working well enough or the side effects are unacceptable. Life is about problem solution. So the problem is that treating erectile dissatisfaction, ED, sometimes isn't as simple as just reaching for the prescription pad. The solution begins with actually asking more questions. You see, as medical providers, we start with a detailed history and an exam, including testicles, prostate, and then we need some blood tests. You see, a man needs 5 basic things for a workable and sustainable erection. Number 1 is obviously you need a willing partner or at least an interesting alternative. Number 2, a structurally sound penis. For guys who have Peyronie's or these unfortunate bends in the penis where penetration becomes an issue, this is a whole nother subset of concerns that we have to deal with. Number 3, the wires have to be intact. That means the nerve supply to the penis and the surrounding areas have to be good. So for men who have had past prostate surgery, diabetes, neurological conditions like MS, chronic back pain, these are all reasons for a man to have poorly functioning penis, and these have to be talked about as well. And number 4, sexual desire, thoughts, and interest, everybody's favorite. I call this the alpha dog. And this includes also feeling good about oneself. This is really about testosterone levels. If your testosterone's too low, it's not going to go. This is really a talk all by itself. And optimizing testosterone levels is vital to good sexual health. Number 5, blood flow. I mean, the penis is basically 2 balloons stuffed into a skin bag, and they need to be filled and kept filled. This also means that the heart needs to be healthy enough to do battle or at least perform reasonable cardio because, let's face it, good sex takes an effort. Each of these categories needs to be understood and may be treated at the same time or separately. And sometimes it just isn't easy to fix. So because there are a number of things that need to be considered, that means that there are a number of treatment modalities and things that we have to use, various medications and various treatments. And you know, one of the most exciting, interesting, and effective tools in our erection tool belt is the use of extracorporeal shockwave therapy, which is also known as the Gainswave. This is a series of painless outpatient treatments using high-frequency shockwave therapy to the penis and genitals. I mean, it sounds awful, but it's interesting because, again, there is no pain, very comfortable procedure. And when applied to the male genitals, these painless shockwaves actually break up microplaques in the existing blood vessels and stimulate the growth of new blood vessels as well as stimulating the nerve supply. It basically breaks up vascular congestion. The resulting improved blood flow and increased sensitivity really helps men, all men, not even those with ED, obtain a better, stronger, more effective erection. You know, we also frequently incorporate what's called the P-shot with the Gainswave treatment, which is placing your own stem cells and growth factors into the penis by injection, which markedly accelerates the action of this treatment, the Gainswave treatment. The idea of a penis needle in the penis, I know it's not all that appealing, but it is a very easy and non-painful injection process with great results. Anyway, the bottom line here is that ED can be complicated and multifactorial. We have a very good batting average for successful outcomes, and the initial consultation is free. So fellas, if you're not performing to your liking, to the satisfaction that you think you could, please give us a call. Come on in. Let's have a private chat. Let's see what we can do to help. I think together we can actually make a difference. Have a great day.